It used to be when you had knee replacement surgery, you could plan on staying off your feet for a while, but that's not the case anymore. In this month's Prescription Arkansas report, Ann Jansen tells us about a new center at Baptist Health that has joint replacement patients up and walking the day of their surgery.
Well, let's see how this motion's doing here.
6 weeks ago, Dorothy Henderson had her second knee replacement surgery.
Well, I think you're ahead of schedule at least.
Dr. John Yoakum with Ortho Arkansas performed the surgery at Baptist Health, and Dorothy was one of the first patients at the hospital's Orthopedic Center of Excellence.
The right knee was done at Baptist with the new joint replacement program that has accelerated rehab. We focus on preoperative teaching and preparing the patient for what's going to happen before, during, and after the surgery. Been very, very helpful in getting patients up and moving much more quickly.
For Dorothy, that meant the same day as surgery.
The day of the surgery, I got back into the room, I guess about 4 o'clock that evening. The guy come up, he said, you want to walk? You want to walk? And I said, well, yeah. And I walked all the way down to the nurse's station.
One of the biggest differences is pain management.
The nurse would come in and said, don't you need something for pain? Well, no. Well, you don't want to wait too long. I better give you something. Well, okay. But I didn't need it.
That's because they injected Dorothy's knee with a local anesthetic.
The new program doesn't involve using spinal pain management, IV pain management, but rather focuses more on getting all the lines out of the patient.
That means they're not tethered to the bed and can go to physical therapy twice a day and spend time in the center's recreation room.
Televisions and exercise equipment, and a focus on, once again, really getting the patient back into more of the activities of daily living that they would like to do when they go home.
Dorothy is still using a cane for balance, but says her quality of life is already improving.
I'm doing pretty good. I can do just about anything.
We think it's a big plus in managing the total joint replacement. It's not so much a difference technically in how the operation is done, but more change in how the patient is educated and managed before, during, and after the surgery. That's really made the big difference.
Ann Jansen, today's THV.